Good morning, class.
Good morning, sir.
Yes, and for me to know that you guys are there, since it is only us, and I wouldn't mind if you show your video as the evidence that you are actually there. Okay, this is not a large class. We are all doctoral students. So please just show your video, and it doesn't matter where you are. And I just want to know that, yes, you are there. Okay. So no, do not worry. Okay, fine. Good. So,
please, sir, sorry, sir, I want to plead that I will show my video temporarily and put it off because of the internet connectivity and capacity, sir.
okay.
Please.
Okay, fine.
Yes, sir. Thank you.
Yeah. Okay, fine. Okay. Yeah. Okay. Agreed. Okay, good. Okay, so we are talking about your doctoral seminar on critical appraisal, an EMS 825. And then for the HPM students, the same course, the same seminar, but it is coded HPM 825. So just for you to know that, yes, it is the same course. Okay, so I will just take us through, let me just share the presentation I have on this, and then we will. So, good. So basically, this particular course for which you have been asked to present a seminar, each of you. So this is a seminar topic, and the way it flows. Sorry, for me to actually introduce myself, since I get it that you may be meeting me for the first time. Okay, I am Dr. Osahon Ogbeiwi. Okay, and I am an associate and a professor of community medicine and public health, and so that I am also acting for the HOD of the HPM department until a substantive HOD is appointed by the VC. So, okay, so basically, what is your seminar about? I have tried to ask Ogumboyo, if you will be required to actually prepare a seminar presentation. Sorry, the seminar presentation on your critical appraisal assignment, okay, which will then be graded, okay, as your result for this course, which means this course doesn't have any formal examination, but the assignment and this seminar will be what we will grade, okay, as your results or your score for this course. Okay, so because of that, before I even go ahead to actually tell you more, I was actually going through this. I have not completely designed the assignment, but it is retaking shape. Unlike what I have asked our masters as the students to do. So masters and the students, I just told them, I actually selected the article, okay, which they are to review using a CASP checklist. I hope you are not hearing about CASP for the first time. Well, if you are actually hearing about CASP for the first time, I will take you to their website, towards the end of this particular session. So, but for you, being doctoral students, and being that you are going to you are going to present a seminar, on the assignment on this critical appraisal. So I am asking you to search the relevant on a databases. I'm sure you know how, but I will still show you how that is done in this particular session. Download 5 recent articles. And I know you also know what we mean by the word on a recent. On a recent means that is in the last 5 to 10 years, not older than 10 years. Okay, but the articles should be related to your research topic. So, in this session, I shall be asking you. I actually believe you should have prepared your research proposal by now, which should have a topic, and it's possible you may have already written in chapter 1, which is in the background, chapter 2, which is actually the literature review, chapter 3, which is your methodology. Okay, so if you have already done that, at least you know what is the subject of your research. So you're going to search for 5 articles for you to study, and you will review, okay, using a CASP checklist. I will actually show you what a CASP checklist is in this particular session. But the catch is that these 5 will not be the same in a study design. One article could be the 5 articles should all be different study designs, okay, and which could be the cross-sectional study, case-controlled retrospective study, cohort prospective study, mixed methods study, RCT, qualitative study, or systematic review and meta-analysis. So by the time you have actually selected the 5 articles that you wish to review, then you must actually download a CASP checklist. There are different checklists for the different study design. Therefore, you need to use the checklist for the right study in each article. And then after you have studied that particular article and you have a good knowledge of the study design before you critique the article using the CASP checklist. So the CASP checklist just has like, and I think the checklist has 11 questions that you are asked to answer yes, no, or can't tell. Okay, and then after those 11 questions, you are expected to then write a summary. Okay, but for each question, you don't just say yes, no, and can't tell. You need to give details of why you have answered yes, no, or can't tell. So, and then from the critique, from the details that you give, okay, and naturally the summary that you gave, then you can write, a summary of your own observations about the overall quality of each article, because that is the purpose of a critical appraisal. It is for you to make judgment of the quality of each article or of each study. Okay, so basically this is the assignment which you will then actually develop into a seminar presentation. So I have set a particular date, anyway for your seminar, and I am trying to actually decide whether you will make your presentations online or in class. Okay, so by the time I have actually discussed it with Dr. Ogbeiwi, whether your seminars will be in class or you can do it in online, then I will let you know. So before I go in, before I actually tell you more about critical appraisal, do you have any question about your seminar assignment? Any questions?
Sir, I think it's clear.
Okay.
I think it's clear, sir. Yes, sir. The steps are clear.
Okay. James, you from a HPM? James, are you there at all? You see, this is why I said people should turn their video on. Now because it isn't, we don't just want you to actually take attendance. This is a lecture. We want you to actually listen and be there. James, are you there?
Yeah.
Okay, fine. Okay, fine. Let us continue. So, yeah. Okay. So, yes. So, to actually, just as a way of introduction, okay, let me just recap what you already know about research methods. Okay, because this is what will help you to actually critique each of those 5 articles. Okay. When we talk about research methodology, we actually talk about the research approach. Okay. The research approach, which basically determines the study designs and study methods, the study tools that are used. So there are three worldviews concerning research, which I want to believe that you already know. Okay, there is the scientific post-positivist view that actually has that worldview that in reality, within a human population, within the world in which we live, can only be actually measured if it is observable. So, typically, therefore, that is the worldview that actually believes that believes reality can be observed, reality can be measured, reality can be counted, it can be tested, it can be objectively verified. So that is the worldview behind quantitative studies. And for you guys, you are actually PhD students. Definitely, you must be very, very strong in a research at a philosophies, because there is a philosophy behind every research approach. There is a philosophy behind quantitative research, and that is the scientific, the fact that the fact that the reality has to be empirically observed. Okay, and then there is the qualitative that has the social science worldview that actually believes that not all that is real within our human population can be observed. There are other things that needs to be explored. You can't observe them, you can't count them, okay? But you can actually construct reality with the participation of the people you are studying, instead of the researcher-oriented and a quantitative approach. Okay, so the qualitative the methodology therefore believe that not all reality can be observed. For example, realities such as how people feel, what people think, the lived experience of a people, their opinion, their stories, their their perceptions, the meanings they give to what they have experienced. You can't measure those in a lab. You can't measure those using any structured quantitative measure. Therefore, the philosophy behind qualitative research it actually evolves from a social perspective, okay, which has its origin in social science type of research. And then there is the pragmatic view. Now, the view that actually, in a way, you can't seriously know everything about the reality in a human population if you only look at what you can observe or measure, or what you can explore or construct. So the pragmatic philosophy says that, look, for you to have a holistic view, you need a mixed method approach. That basically means you mix the quantitative approach with the qualitative approach in a way that best suits the study question of your research. Therefore, you need, as a PhD student, to be very, very vast in these three worldviews: quantitative research approach, qualitative research approach, and mixed method research approach. Okay, so then with these three in mind, let us go through the study designs. If you can see this in a flow chart, can I have a confirmation that you can see this flow chart?
Yes, sir, we can see it.
Yes, sir, we can see it.
Okay, good. And so that when we talk about the quantitative research, okay, this flow chart tells you that, look, there are two major categories of quantitative research. Okay, one, the first group, they are the observational studies. The second group, they are the experimental studies. Okay, so, and of course, the observational studies, they are also called surveys. Okay, while the experimental studies, they are also called trials or tests. So if we talk about the observational surveys, okay, here you can actually categorize them broadly as either a cross-sectional descriptive study or a longitudinal analytical study. Okay, sincerely speaking, there are two ways people define a cross-sectional study. First of all, it actually means that you don't actually study, you don't actually study the whole population, but that you take you actually observe a cross-section, either males, females, adults, children, rural women, urban women. Those are cross sections. Or the other way people look at a cross-sectional study, they are studies that you do at a particular time or period of time. In the cross-sectional, well, those of us who actually studied medicine, and I know you will understand when we say a cross-sectional view. We always say, if you take a loaf of a bread, okay, and that loaf, which is long, okay, if you cut it from one of the ends, which means you will not see what is in the full length of that loaf, but you can see what is at the end that you have cut. So that view is what we call a cross-sectional view. Okay? You don't see the whole of the bread, but you describe what you can see from the cross section of the loaf. Just me trying to actually explain what cross-sectional study does. It takes a cross-sectional view of the population that you are studying, maybe a particular topic or thing, to be able to describe how that particular study population is at the time of your study, which is the opposite of a longitudinal study, which takes a long view. Okay, like if you take the example of that particular loaf of bread, which is when you actually slice it along its full length rather than from one of the ends, what you get is a full length view from the beginning of that bread to the end. And so that in a way, so this is more like a long-term period of the survey, okay, over time, okay. The analytical studies, there are two broad types. If you take a longitudinal view over a past period, those are the ones you call retrospective analytical studies. If you take a long view over a future period, though that is the type of a study that we call prospective studies. So that when you talk about retrospective studies, well, this the flowchart tells you that, look, if you know that yes, retrospective, you may also have a record-based retrospective descriptive studies, which means you are not finding you are not doing any cause effect analysis. But it becomes analytical if you are doing cause effect study, which then makes the retrospective study, particularly if you also study a control group, you have a case control study. The prospective study, the group you are studying with the risk factor, you call them the cohort group. because they are already exposed to a risk factor that could cause the disease, and you observe them over a future period as a cohort. Okay, so that you are able to more accurately estimate the incidence of that particular disease. And that is the study that we call the cohort prospective study or the cohort control study. So the cross-sectional descriptive studies, they could be population-based, household-based, community-based, or institution-based. So all those studies that you do in health facilities, if they are cross-sectional, descriptive, they are institution-based or facility-based cross-sectional descriptive studies. So that this is the wide range of the designs under observational surveys. And then when you talk about the experimental studies, okay, also you have two groups. You have the true experiments and the false experiments. And the difference between the two is that the true experiments, the way you assign participants to the intervention and the control groups, they are randomized. Whereas the false experiments, they are not randomized. No, you assign them purposively, as may suit the question you wish to answer with your experimental study. Okay, and then the false experiments, they fall into two groups. There is the non-control group, which is the pre-post test studies. That one uses only one group. Okay, at the beginning, you take the first observation and you call that the pre-test observations. And then you introduce the intervention that you wish to test. And then after the intervention with the same group, you then observe over time the effect of the intervention, which means you can then have post-test observations over time. What we call what we call the follow-up interval periods, 3 months, 6 months, depending on how long your study period is. So that is the pre-post-test experimental studies. Okay, there is the experimental studies that are called quasi-experimental studies. Well, that particular word, quasi, also means false. But they usually will have a control group as well. You have the intervention group and the control group. So for all of them, you first take the pre-study observations, which is the first one. Okay, so before you then introduce the intervention to the intervention group, then the placebo to the control group, and you also observe the effect, okay, in both groups over a period of time. So that the quasi-experiment is a false experimental study because it is non-randomized. So it has been said that the gold standard for actually testing interventions is the true experimental studies. So if you have actually heard about RCTs before, RCTs meaning randomized control studies, control trials, okay, RCTs. So again, these ones fall into two groups. There are the RCTs that are non-blinded. They are all controlled. Okay, certainly RCT must have a control group. And then there are the RCTs that are blinded or blind RCTs. But then blinded has different levels of blinding. Blinding just means the extent to which the three groups that are involved in that study, the extent to which they are blinded towards which treatment, which intervention is given to which group. Now you have these study participants, that is one group. You have the researchers, that's another group, and you have the data analysts, all the statisticians that fall into the two groups. So if you only blinded the study participants concerning which group they are, and they are the only ones that do not know whether they are receiving the intervention or not, you call that RCT the single blind RCT. So the RCT is actually double blind if you only blinded the study participants and the research team, so that even though those people are carrying out these studies, they do not know who is receiving the intervention and who is not. But the data analyst will know and will be able to actually separate both during data analysis. So that is the one that is called double blind. On a triple blind is when all three groups are blinded as to which particular patient is receiving the drug, the treatment, the intervention or not. But the interventions and the placebo, they are coded so that even the data analysis, and so that even the data analyst wouldn't know even during data analysis which particular patient is in the intervention group and which one is not. But then by the time the codes, so only the people external to these three people who understand the codes given to the intervention will know which group had the intervention or not. So that type of RCT is the one that is called triple blind RCT. So that these are the study designs that we have under the quantitative research approach. Do you have any question based on this?
Hello, sir. Yes, sir.
Yes, any question?
Yes, sir. Just with one example, sir. Please, can you use that example to differentiate between RCT and quasi experimental studies, sir?
Okay.
Because they are kind of confusing to me.
Oh, okay. Go. Okay. So what I have said, okay, RCT belongs to the true experimental studies because the assignment of the study participants to the study groups is actually randomized. Okay. And the way you assign the patients, for example, you're actually testing a new malaria drug. Okay, it's a drug that is not yet out there in the market, but there is the hypothesis that look with this drug, if actually patients take it at a certain dose, they just take it once and then they will never be sick with malaria again. That will be a very, very powerful drug, isn't it? So, but now, which study will you do that will give unbiased evidence of the efficacy of that new malaria drug? So that when you now do DRCT, okay, you actually randomly assign, who should be in the intervention study group, and then who should be in the control group. That particular control group, you just give them a multivite, even though it may have the same color as the new drug, but but those people carrying out that particular study, they know which drug is the new drug and which drug is the placebo. But the way you assign who should be in the intervention group and the control group is completely at a random. Okay? So using a process that we call randomization. It is different from how you do a simple random sampling. No, there is a way patients are actually randomized, in that there is elimination of a bias completely in the assignment of the patients to the study groups. Whereas now quasi, it is possible that you want to actually test that drug and then naturally find out the difference between how that drug reacts with people who are Yoruba people, and then people who are who are not actually Yoruba people. So that now using a selection criteria, you actually purposively assign only Yoruba people to the intervention group. So that isn't actually randomized at all. You have used a criteria to decide who receives the new treatment and who does not. So that particular design is the one we call a quasi-experimental study. So that even though both of them will have control groups, but the assignment, de-randomization is what actually differentiates quasi-experimental studies from the true RCTs, which are the true experimental studies. Does that answer your question?
Yes, sir, it does, sir. As a follow-up question to that, sir, you mentioned in RCT, you said we randomized and is different from a simple randomized technique. Is it that we use a kind of a systemic random sample where you pick every fifth person or every seventh person for randomize, sir?
Oh, no. To randomize, just means that one, you can use a computer to actually assign. Okay, so which actually means that the researchers do not decide who is. As an example, if you have actually all of them inside a big hall, okay, you can tell them, please, all of you take the numbers 1, 2, 1, 2, 1, 2, 1, 2. All the ones go into the intervention study group. So you did not purposely put them there. Okay? And then all the tools you will use as your control. Okay? That's actually a simple way to actually randomize. So, or you basically, if they all already have the numbers, okay, yes, it is true, you can actually generate it also random numbers. The patients whose the numbers fall, we within the random numbers, fall into either the control group or the intervention group. Okay, so basically it is in the way you assign the participants to your study groups. Okay, so yes, it is possible that you say that, well, that is like a simple random sampling. For a simple random sampling, you have only one sample, but for the RCT, you have 2 or so samples, and you use random selection, to decide who goes to the treatment group and who goes to the placebo group. So without this selection being controlled by the researcher or by the study participants themselves. Okay, is that clear?
Clear, sir.
Okay, thank you. Any other question? Okay, fine. So if
no sir, go ahead.
Okay, good. Okay, so now let's just go on. So now if we do the same thing for the qualitative designs, Okay. Very many people think that the qualitative studies use only one design. Do you all believe that it actually uses either the in-depth interviews or DFGDs, and they call those ones now designs? Interview is a data collection method. FGD is a data collection method. They are not study designs. Therefore, when you are presenting your proposal, don't say that you carried out, that you conducted, or that you will conduct a qualitative study using in-depth KII, in-depth interviews, or FGDs. You have just told us the methods you used to collect the data and not the study design. Because when you talk about this study design, you are talking about the strategy that you used to conduct your study. And that particular strategy is what determines the data and the collection steps, the data analysis, and how you interpret the data that you collected. So that is how a study design is different from a data collection method or a data analysis method. Data collection, data analysis, data interpretation, or synthesis, they are all determined by the study design that you have chosen for your study. So when you say you are conducting a qualitative research, what determines your design is the core issue that you are exploring. And I hope you know that every qualitative study is explorative. Okay? And then they are also usually constructive. So it depends on what you are exploring or what you seek to construct. So if you are exploring the lived experience of the people you are studying, you have to ask yourself, is the lived experience individual lived experience or a shared lived experience? If it is a shared lived experience, then there are three main study designs, qualitative designs that you could use. So if you are studying the shared culture, then you definitely will use a study that is called ethnographic study. So if you are studying their shared essence, the shared essence of their bad experience that they had that you are exploring. And for example, grief or loss or pain or surgery. So you want to know the essence, the summary of how they all felt at the end of the day. And so, for you to study their shared essence, the study design you need to use is the phenomenological study. If it is a shared process, they all pass through that experience they had is a shared process. No, a process by which, as an example, by which they actually prepared their food. As an example, they all prepare food using a shared process, a shared method, a shared model. Then the qualitative design that you need to use is the one that is called grounded theory method. But if you are studying in individual cases, individual experiences, and you want to actually report them individually, then there are two qualitative designs you might use. When you are studying individual life histories, because that is what a biographical study is about. So that study is called a narrative study or a biographical study, because you want each of them to tell their stories. Everybody has a different story. And so you actually report each different story one by one, okay, in the narrative study. And then, if it is a unique experience, then it is best that you use each case, each study participant as a case study. So that one person that has had that unique experience, you then explore them, examine them in detail. If it is one patient, you then explore in detail everything about that unique experience that one person or those few people have. So those are 5 different qualitative designs. There are more than that, but those are 5 important designs that you might use if you are exploring the lived experience of your study participants. But if you are exploring the quality of health service, then you need to be able to say that yes, that you will conduct a process evaluation, because that is what service provision is. It is a process. Process evaluation. And that has its own design as to how it is done. Then now there's another one, even though it is more like a data collection method, but yes, it is called direct participant observation, which means when you go to a clinic and you directly observe how they are performing, how patients are being treated, and how patients react without you interacting with anybody. You just you go and you are a part of the system, and you directly observe what is happening. through your participation in the process. So that is what we call direct participant observation. So, but if what you are exploring is, there are the problems, and you wish to identify and to analyze the problems affecting your study population, then you can use designs such as the rapid rural appraisal. Okay, in the rapid appraisals, the DRAs or the PRA, and or you can do also a document and a review. Instead of you talking to people, you basically review documents that relate to their problems, and you call that content analysis of that documents describing the problems affecting the people. And then, of course, you can use any of the needs assessment and techniques, okay, to explore problems affecting your study population. And at times, you can do a perspective study, okay? So, which means that you just want to know the opinions that your study population has towards a particular subject. And basically, yes. So these are the two study methods that you can use to collect data concerning their perspective, their opinions, their meanings, so either you use the key informant individual interview called KIII, or you use the FGDs, which is which means you actually gather 6 to 8 people together, and you have a particular way of you carrying out that data collection exercise. Using using a discussion topic guide. So these are the different qualitative designs that you will encounter in the articles you will review, and so in your study as well, so that you may need to go back to your chapter 3 of your proposals for you to make sure that you have selected the right study method for the right study design for the right research methodology. Do we understand that? Any question on this?
Sir, thanks. Thanks for the elaborate explanation of all these study designs. Please, sir, I want to find out if you're doing like a formative research, what kind of study design apply to that?
Formative deals with research about actual development of a service, of a project, of an idea. So definitely you can use the qualitative approach, but at some point it is it is going to be a mixed method and a study.
Okay. Okay. Thank you.
Now, because at some point, you need to actually observe, okay, and then you actually report using quantitative data. Then at another point, you need to actually explore to get deep perspective of the participants, on the process, so that in a way, if it is informative research, definitely at some point it is going to be a mixed method study. Okay.
Okay, sir. Thank you very much, sir, for the explanation, sir.
Yeah. Okay, now your name, please. No, your name is not showing. What's your name?
Sir. My name is Ajayi Bukola, sir.
Okay, yes.
Ajayi Bukola. Yes,
okay,
sir.
Go on, yeah.
Yes, sir. The question I have is on mixed methods, sir.
Yeah.
So I would like a brief explanation of the sequential and the there are two that are very close.
Yes. Good. And thank you, because that is the next thing, the next thing that I shall be talking about. Okay, good.
Okay, sir. Okay, sir. Yes, sir.
Yeah. Okay, fine. Let us go back. I'm sorry, the time is actually going very, very quickly. So, 1 hour is already gone. And yet we have not still talked about how you will do the critical appraisal. So this is just like the background to that. Okay, so now talking about mixed in a method and approach. I actually told us that look, this is a pragmatic an approach because it is action oriented. People who do mixed methods, very, very often they want to use the results to change things within the society or in a program or wherever this particular study is being done. Therefore, it is called pragmatic. It is action oriented. But because of the way you mix the quantitative and the qualitative studies, so there are 4 actual designs. Some people say 6, but let me just present these 4 here. So basically, you can actually categorize mixed actual methods under 2 broad headings, just as you can see. There are the mixed methods that are actually sequential. And the sequential means you do one first before you do the next one. So which means you conduct in a series. Either you do the quantitative study first before you do the qualitative study, or you do the qualitative study first before you do the quantitative. So for a sequential mixed methods study, okay, if you do the quantitative study first, which means you use a structured questionnaire to collect data, and then you actually carry out this statistical analysis of the data, and you now know the means, the actual percentage. First, you complete the quantitative study, then you might need to go and do the qualitative for you to explain the findings that you got from your quantitative study. So that if you do quantitative first, then the mixed method study is called sequential explanatory study. But if you do the qualitative first, always remember what I said, that look, all the qualitative studies, they are exploratory. Therefore, if you do the qualitative first, before you then use the results of that qualitative to design your structured questionnaire, okay, for the quantitative study later. So you call that one the sequential exploratory study. So on the other side, you may not have the time to do one before the other. You might just say you will do the two of them together in parallel. As you are doing one, you are also doing the other. So you have those ones that are called parallel mixed method studies, or concurrent mixed method study. So now, if you do quantitative, if you do them at the same time, but separately, separate data collection, separate data analysis, but you now integrate your findings during interpretation. You call that one concurrent triangulated study, because you have used different separate methods to collect data looking at the same subjects or variables. And then during data analysis, before you then integrate the two. Yes, it's a concurrent or parallel mixed method study, but actually you have triangulated these study methods. The other one, in which you mix qualitative questions with the quantitative questions in the same tools, which means you collect quantitative data, qualitative data together, and you analyze them together. You didn't do them separately. You have actually embedded the qualitative study in the quantitative component. So you call that one concurrent embedded mixed method study. So this is the that I want to say on this. So before we go on to critical appraisal, Ognajayi, does that answer your question?
Yes, sir. Thank you, sir.
And so that by the time you write your proposal, once you say you did a mixed is the method and the study, please don't just end there. You need to tell us the particular mixed method design that you use and how you mixed the quantitative and the qualitative component. Okay, Adeyemi?
Thank you, sir. Sir, for clarity, sir, I want to go back to the concurrent triangulated study.
Yes.
Yeah, you said it's a study whereby both are done concurrently, but the analysis is done differently. Am I right, sir?
The data collection is a separate. The data analysis is a separate. Okay, but you are doing both of them in a parallel at the same time. And then you only integrate your qualitative and the quantitative findings during interpretation and the synthesis of your evidence. Okay, so that is the one that you call on a concurrent triangulated mixed method study. Okay, you conduct quantitative interviews, okay, using a questionnaire, and then you also do FGDs to actually confirm basically, it is the same study, but you use different methods to actually examine the same variables at the same time. Now, separately and in parallel, but it is during interpretation when you are discussing your results that you then integrate, okay, to make one conclusion from the two studies that you have done together at the same time. Okay, is that clear?
Clear, sir.
Okay, good. And so now with that, now let us
Sir, please, write down.
Yes, thank you.
Yes.
Because of time, let me.
Sir, please, this is just a quick write-on. Does it mean for concurrent embedded mixed study, you cannot do triangulation?
No, because the way you can't, but you have actually embedded the qualitative data, with the quantitative data, during data collection, during data analysis, you actually analyze them together. You collect the data using the same tools. So, which actually means that one, they are not separate actually studies anymore, so to say. Okay, because you have actually mixed them, right from data collection, data planning, data everything, data analysis. Unlike the triangulated one, that you only integrate them during the discussion of your results. Whereas de-embedded, you actually integrate them earlier during the tools, the data collection, data analysis. Basically, you are doing both of them, and it is possible people will say that might be the real study we will call mix, because the data you will get is, you actually collect will be mixed quantitative with a qualitative data. Now, which means you start to actually explain or to actually explore at the same time. So, and it is possible if you look at what the word triangulation means. Triangulation just means you use different and separate study methods, okay, to examine the same subject, okay. And so, but if you have used, as an example, you are conducting an interview, okay, yes, you can ask them closed-ended questions and then ask them open-ended questions using the same questionnaire. By the time you actually do that, you have actually embedded the qualitative study in your quantitative, and you are carrying them, doing them together. So that is the difference between the embedded study and the triangulated study. Oh, okay.
Thank you, sir. Clear.
Okay, so now this particular chart helps you to actually understand. Can you see this chart? Yes? Can you see the chart?
Yes, sir.
Yes, sir.
And so that then you can see the triangulation design, okay, says you actually conduct the two studies the same time, but in parallel, separately, okay, which means you don't mix them, okay, but now the results are then mixed to be able to interpret the two data types that you collected. Yes, you have used them as different study methods, but you now mix later, at a later time during your study. So, and then when we now talk about the explanatory, this is actually sequential, okay, you conduct the quantitative and carry out the analysis, and then you use the results from there, okay, to go into the community to ask them questions. And as an example, if you found that the death rate is high, maybe from your quantitative study, you have found that yes, 1 out of every 10 10 childbirths end in death. So the quantitative already gave you, the figures. So you now go to the community to then explore what is actually responsible for such high deaths. So that is why it is called explanatory. Exploratory, you first of all collect qualitative information, their opinions, knowledge, an attitude, and a perception, which you now use to now design your quantitative questionnaire, for a more structured study. The embedded qualitative questions, data embedded in your, that is in a quantitative data collection, data analysis, data results, and you just mix them together as you go. So that is the embedded design. So that is that. Now I have 2 minutes to just go through the main topic now for your seminar. So all that is to help you understand the different research methods, for you to be able to critique the articles you will select. So at a doctoral level, we expect you to know a lot about critical appraisal, and this is what, so your critique is what you will present as your seminar. So now what is it? Basically, as I said before, okay, it is a systematic way of you examining the quality of research evidence reported in articles. Basically trying to actually find out whether the process they have used is of a sufficient good quality as to generate good and unbiased results. Okay? And because if they have not used a proper process, then the results will be very, very faulty. And that is what we want you guys to now do. Every article you are going to pick, when you are when you are actually reading it, you are to carefully and also systematically judge the evidence. The evidence that the studies report, can they be trusted? Are they of good value? Okay, what did they use the right methodology? Okay, to answer the right study question. So basically, critical appraisal, you are identifying the strengths and the weaknesses of the studies reported in each article. And that means you are going to behave as the experts reviewing the articles, even though they have been published. Okay? So, and that is what we call critical appraisal. So, the main components, you judge the validity. And so that when you make your presentation, you need to actually comment on these particular variables. The studies or that particular study, was it valid? Did they use the right methods, the design, the sampling, the data collection, the data analysis, were they scientifically sound? Did they eliminate bias? That refers to the validity. The methods, were they valid? Now the results, are the results reliable? So note, methods valid. Results reliable. Can you trust the results? Okay. Did they come out of an accurate measurement? And then the third one is what? Applicability. The findings, the evidence, the conclusions, can they be applied to the population they studied or to other populations? So please note these three components: validity, validity of the methods, the reliability of the results, and then the applicability of the findings or the evidence. Can they be applied? So then why is it important? That is because very, very often doctors, nurses, public health experts make important decisions based on research evidence published in these articles, so that if the articles, if what they actually reported, if the methods were not valid, the results are not reliable, and the conclusions are not applicable. And in fact, if these study methods are not replicable, then that means the decisions made to develop health services and to make policies will be faulty, and it will give the health system as a whole bad and poor and, sincerely speaking, outcomes that will be irrelevant. And you can't use the research and evidence to make any clinical or public health developments. That is why this is very, very important. Okay? And then identification of bias. So it helps us to identify flaws in the research approach. Did they use quantitative approach, okay, to measure qualitative variables? Then you will know that there is a flaw in the research approach. Are there flaws in the design used? That is why we want you to actually download the specific checklist that will help you to critique the relevant study design. And then critical appraisal helps you. At the end of the day, you are trying to actually separate high quality evidence from low quality evidence. Okay, so basically talking about how it is used. Critical appraisal is a strong part of a systematic literature review, because it helps you to actually select credible articles for your literature review. And it is possible, those of you who have already completed proposals for your PhD research in a thesis, you need to do a strong literature review. Those of you in my department, well, I am very, very strong about how you conducted the literature review that you used to write your chapter 2. And it is important that you know how to do critical appraisal of the articles that you selected for your literature review. Okay, because if you actually selected poor quality studies, then your literature review will also be faulted. So it is also very, very crucial in us interpreting research and the findings and ensuring that the recommendations they made are logical and scientifically sound. So definitely every person who is a senior manager, who lead public health teams or clinical teams, need to know how to do critical appraisal, as an essential skill, as part of their evidence-based practice, so that they know how to actually decipher evidence that they read about from a published research before they begin to use that particular evidence to change things within their health service. So it is something they must know. So the tools, this is where we now come to. So there are a range of tools here. There are the tools that we call the CASP checklist. CASP means Critical Appraiser Skills Program. That is CASP. So it was already developed in a checklist that you can use to critique the studies, the articles, before you use the evidence for a literature review or to design your health practice on them. So, CASP, I will show us an example soon. Then there are the tools, the worksheets, is now calculators for assessing the quality of studies called the CEBM, Center for Evidence-Based is the Medicine. And then there is also the JBI checklist, Jonah Briggs Institute checklist. They basically do the same thing as the CASP checklist. And then there is also what is called the pyramid of research evidence that helps you to actually grade those studies that are rated high quality, top quality studies from those studies or articles that you can say they are low quality research or academic literature. Before we will go on to the pyramid, let me just show you an example of a CASP checklist, because I have told you No, I have told you that you will use CASP to critique 5 of the articles for your seminar. So let me just go, come here and just show you okay, sorry. Okay, let me just show you an example of a CASP checklist. So that when you go online, you will see CASP checklist, and you can download the checklist that is appropriate for the study design you are critiquing. So that when you, please fill here your name and your matriculation number, please, here, the title of the paper, the authors, the web link, and the date of the appraisal. And then, just as I said, the CASP checklist asks you questions so that if you have studied the article, you should be able to answer the question. And for example, should I enlarge this? Can you all see this?
Zoom it a little.
Okay. Okay, is it okay?
Yes, sir.
And for example, now question 1, it says, did the study address a clearly focused issue? You can only answer this if you have read it. So you tick yes, it clearly addressed a specific issue. No, it did not clearly address any specific issue. Can't tell, which means that particular article is ambiguous. You can't tell, not because you don't know. Please know that there is a difference between can't tell and I, who is actually critiquing, don't know. You should know. But the article, but you cannot tell because the article is not specific enough. The key word here is clear. If it is not clear, therefore you can't tell. The other key word is the issue, which means you can't tell the particular issue that article is actually talking about. So, and then whatever answer you give here, please write the why you have ticked yes, provide your evidence. The evidence should come out of the article. If you say yes, tell us what the clearly focused issue is. If it is no, tell us no, tell us why. Tell us something. Don't just click yes and then go away. I will not accept that. You need to explain your answers. Even if you say can't tell, explain. If it is not clear and so you can't tell, explain. And then the same thing, question 2. Did the authors use an appropriate method to answer their question? Okay. That now tells you about the research approach and the study design. Yes. If it is yes, tell us about the research method and why you consider it appropriate. That is why you need to read about the research method before you critique a study. Because you yourself, you must know if they have, whether the approach they use is appropriate or not. So yes, no. Then the second question says, were the cases, if they're recruited in an acceptable way? Know that this is about what? This is about the recruitment. Okay, and the sampling, which means the selection. So you need to know about the sampling methods before you can judge whether they have used the right method for their study or not. And every answer you give, please write give the information here, details you can see. You can type here. Always explain. Okay, good. Always explain. If you tick yes, give us evidence from the article. If you tick no, explain. If the article is not clear, the article is actually ambiguous about how they selected their sample, then you tick can't tell, and you tell us why you, who is the judge, cannot tell. Don't say you can't tell because you don't know. I will not accept it. Okay? So that this is an example of a CASP checklist. Okay, let me go off here. Yeah, yes, before I go, in CAPS, after you have finished answering the different questions, this one has 6A, 6B. After, then there is here the appraisal summary, so that for each an article, you need to now talk about what is positive, a summary of the positive things from your review. And here, a summary of the things that you considered as a negative, which means that all the yes will be summarized here. All the no will be summarized here. And all the can't tell, which means missing information that you would have wanted, but you cannot tell because either they are not. So this place is like one of the most important part of the checklist. Okay. So the other part is just giving you information. So, and then if you want to know where to find these checklist, you should go to Google. Here, when you type in CASP checklist, it will come out. Look at it here. CASP checklist, critical appraisal skills program. When you click it, all the checklist you need to fill, please only download the Word version. Okay? For a systematic review, you click this, the checklist will come out. Qualitative studies, cohort studies, case control studies. Where is cross-sectional studies? Yeah, here. Okay, so that they are all here. Qualitative here. So, and all you need to do is when you click this, it will open here and you can download. Please download the Word because you will need to write in the checklist before you send them to me. And then it is the information on the checklist that you will use to prepare your seminar presentation, where you will critique the articles that you reviewed. Okay? So please download the Word. Okay? And that is how you will get the tools for your critical appraisal. Okay. So now let me leave here and go back. Good. So that's talking about, so now for us to now end, this is actually for your information, pyramid of research evidence. So this, you can use this pyramid to judge the level to which you can trust research and evidence from the different study types. Okay, it ranks the quality of research evidence. So you have the number one that is actually considered to be the top rated, highest quality research and evidence. And then you have 5 or 6 that is the poorest. So, so those that are at the top, they are the ones that are called what? Systematic reviews and meta-analysis. They are the ones that are the best top quality research. Sorry, let me make this. So that these are the ones at the top level. And actually the reason why they are top is that they have brought the evidence, they have integrated data from a number of studies, okay, to now combine into one sample, okay, and they have selected those particular papers using quality criteria, and they have also critically appraised the articles that they reviewed. Therefore, it is expected that actually these systematic literature reviews, they are the highest possible quality. They provide the highest possible quality of a research and evidence. On the level 2, they are the RUCTs. RUCTs, they are also considered good quality, best approach. Therefore, any evidence reported from RUCTs, they are usually considered trustworthy. But they say because there could be selection bias, so it might not be as trustworthy as a systematic literature review. Then now the next ones, are the controlled studies. Okay, the analytical studies. If a study has a control group, it has higher quality than a study that did not use a control group. But the quality might not be as good as the DRCTs. You know, the DRCTs usually randomize their selection. Therefore, they have actually minimized bias to a higher extent than in a cohort study, case control study, or a quasi-experimental study. So the next level, they are the descriptive cross-sectional studies. Okay? They are not as good as the analytical studies, but they are better, you know, they are more objective than the qualitative studies. Because all these studies, their own weakness is in their lack of objectivity. Okay? Therefore, these are the lower level, any evidence that you get from a qualitative study, case studies, case in a series, project reports, you will know that, look, there is a high chance of bias and subjectivity than in a descriptive cross-sectional study, that is more objective. Okay, so, and definitely in these particular studies from this particular level, you cannot generalize beyond the people that you studied. And then the list, they are the opinion papers and the anecdotal reports. The word anecdotal means the evidence they report, they are not research, or they are not evidence-based. As an example, the evidence that you actually gather from all gray literature, as an example, in the newspapers, in the newsletters, opinion papers, they are most often anecdotal reports. So, which means they are not research-based. Therefore, they are the least quality research evidence just by this particular pyramid. So basically, I will end with where I started. So now, please go back. Okay? I don't know your research. Maybe let me actually collect it here. So please, if you can all hear me, now I want to know this subject of your PhD research. So now what I am asking you to do now for your seminar, okay, search relevant databases. I hope we know how to do database search. And I can also show you here if you don't know what to do. So go.
Teach us, sir.
Eh?
Say, teach us, sir.
Yes. Ogna, look at it. So, for example, if you come here, go over to the school library. Type in UNIMED. Go over to UNIMED in the library. Okay, so you're going to find this is our library website. So these are all databases. Okay, so where you can find the articles. There is PubMed as an example, that if you click in the PubMed, okay, if you type the main things in the topics, yes, the main themes in the title of your PhD research. For example, if it is malaria prevalence in Africa, let me just assume that is what I'm actually researching for my PhD. So here it will give me a lot of articles. This one now gave me 407 articles for the prevalence of malaria in Africa. So if that is my doctoral research. So, but, okay, if you can look at all of them, good. But now it has actually helped me to say that these particular articles are the articles published within the last 5 years. And these are the articles that will give me free full text, which is really what I want. Okay, so that all that I now need to now do now is to go through them one by one. Okay, so this one you can tick if you want only reviews and RCTs, but now let us leave it at that. So now you now need to now look at each of them and then see which one is relevant to your own research topic. Which one is close? The burden of malaria in East Africa. So definitely this is a prevalence in a study. But you now need to now ask yourself, is it a cross-sectional study? Or
Sorry.
no? Yeah, thank you. So a cross-sectional study or a case control or RCT, because I am asking you search for one case control article, one article that is cross-sectional, one that is really prospective, one that is probably a mixed method, one that is RCT, or one that is really qualitative, or a systematic review. Whichever design that you select, let it be related to your PhD research. And then you are reviewing, critically appraising the evidence that they contain. And for example, so if I see this one is like my own study, I can get the free article here. So and I will click it to be able to download the article. Okay, so this one should have free text here. Okay, so for me to get the article, I just need to click this. I think so. Let me see if it will produce it. Okay, so good. So it should give me the article because it says free article. That is it here. Once I click this, it will. So that is how you get the article. And so here, so that you can see that this one can be your first. So if I pick this, that means I am going to critique a systematic review article. Okay? Oh, no, that is it. So, and then basically now use the CASP checklist for systematic reviews to now critically appraise this article. And that is what I'm expecting you to do. So basically, this is it here. Good. So and then on and on. You can go on from there. And all I want you to have to select is 5. So I already have a systematic review an article. And now I need one that is a cross-sectional review. Which one is this one? So the only way you can know malaria amongst under 5. In a scoping review, this is another review. So we don't need this. Prevalence of a malaria in. So let's see whether this is a cross-sectional study. And that is what I just want you to do. So I note this is searching from a database. Consisted of 101 conducted. You can see that, okay, this is a cross-sectional study, but the study design is not named in the abstract. Okay, so that is already a critique from me. So then I will go on to the main article to now check. So this one too should also give me free text. Yeah. So, and if I want it, I will also click here. So, so that is just one database. So this is another one too that is very, very good. Neither Natello and Francis or actually JSTOR. Okay. So, and then if you say this, that one does exactly the same thing. Okay, you just type in the keywords relating to your PhD study. If I say mine is malaria prevalence in Nigeria. Let me even say childhood, if mine is childhood. Okay, once you click this, it will give you articles. See, See, it has given me 2,086 articles so that you can access database from the university library website. So here, look at it, survey, nothing malaria. So that isn't actually directly related to my study. Prevalence, now this one is. Unawosholu. And this one tells me it is a cross-sectional study. So I already had an article that is a systematic review article. Now this is now my second one because it is a cross-sectional study. Okay, and that is how I will do search databases until I find 5. Then 5, I will read them and then fill the checklist, and then the evidence of my critique is what I will summarize to write my seminar presentation. Okay, so, and then if you want, you can go to Google Scholar. Google Scholar is another very, very good one. Okay, but it is not as it is not as trustworthy as a PubMed or the other databases we have just looked at. So if you say childhood malaria in Nigeria, prevalence, yeah, the prevalence or not, yeah, or risk. Let me change this one to risk. So risk of childhood. So it will give me, this one also gives me quite a lot of it. Okay, and then it will give me free PDF that I can actually download. Okay, if I want, I will click this and the article will come out if I consider it relevant to my study. So that is how you do literature search, my dear people. Okay, do you now understand?
Yes, sir. Thank you so much.
Okay, so now you critique the article using the questions in the CASP checklist as relevant, again, to the study design. And then you summarize the findings of the strengths, that is the positive, and the negative. Sorry. And the gaps. Okay. So, okay. So that you'll be able to now make conclusions, conclude about the validity of research methods reliability of the results, and the applicability of the findings or conclusions made in the article. Okay? So basically, so this is the work from 5 articles you will then use to write to prepare your seminar presentation. But you will send me 5 na checklist for me to mark. So for each checklist that you send, 20 marks. 20 times 5, that is 100 marks. So that if you do a thorough work, 100% from your checklist, and then my seminar, well, I am going to ask Nogumboyo and see if we will want it to be a physical seminar or a virtual seminar where you will tell us the articles that you reviewed and how you have critiqued them. Okay? Any questions? Yes. Yeah, please. Now for me to know, can you quickly tell me your okay, maybe you can do it on Zoom. Just write in the chat your name, okay, your name, and then your PhD research topic or subject if you have already chosen one. Okay, if you have not yet chosen one and okay, you are probably still exploring, and also let me know that yet you are still exploring. So, now quickly write that is in the chat, and then I will copy it from there. Okay, your name, also matric number, and so that when I get your assignment, and I'll be able to know who is who. Name, matric number, and your PhD research topic. Okay.
Sir,
Yes.
I can't access the chat. I'm trying to open it, but I can't open it. I don't know why.
Okay, fine. Send it to me by WhatsApp.
Okay. Okay.
Okay, good. Some I've already sent. Okay. Yeah. Okay. Okay, good. Okay, so yeah. So if you can't send it by chat here, and send it to me by email or WhatsApp. And so please, because
Is this your WhatsApp number?
okay, fine. Let me give you you are going to see my WhatsApp. My main WhatsApp at the number now is +44 7999 444 545. Okay, so
take it again, sir, please. Please, sir, take the number again.
I've actually sent it in the chat.
Okay.
Okay, so that is my main WhatsApp number. And then The assignment, okay, so I should get all of your checklists before the day of your seminar presentation. So I will purposely fix that date. Yes, wait, let me just check. I should already have a date. Just wait, let me check the date that I have, particularly for my HPM people. I already have a date for your seminar presentation. So that date is good. So the date that I put here, well, on Wednesday, the 24th of June. So for PhD seminars, for those of you who are still doing MPhil, you have not yet progressed. Well, MPhil, PhD is actually the same. That one is only for the masters. Both MPhil and PhD, no seminar date, now Wednesday, 24th of June. So, which means that I should get your checklist latest Monday, 22nd of June. All 5 checklists, so that I am actually giving you practically 6 weeks for you to do this assignment. Okay, is that clear? Is that clear, sir? Or ma'am?
Very clear, sir.
Yes, sir.
Okay, so which means this is going to be your only assignment for this course. No exam. So I should get all the checklist latest by 10 a.m. Monday, 22nd of June. Anyone that comes late will not be marked. Please.
Hey.
No, thank you. If you send it late,
Thank you, sir.
and it comes after that day and time, I will not mark it. Okay, so thank you so much, everyone. Have a very, very, very wonderful day.
Sir, before you go, sir.
Yes?
We might also need your mail too, sir.
Okay.
And then secondly, I'm one of the PhD students that reached out to you via your Nigerian WhatsApp, sir.
Okay, yes.
And 2, the second person is also on the call. If I don't know if he's in a very bad network area, and I don't know if he's available now again. His own supervisor resigned. That was Dr. Oladoyin. At the moment, he has no supervisor.
Yes. Now, because he is in my department, I will supervise him myself. Okay. Now, where is he? And he's not here today.
He should be on the call.
Hello, sir.
He isn't here today.
He should be. He's here. He has been honored because of his bad network. So he even chatted me privately. The network is bad in his area, sir.
Okay, fine. Okay, tell him to contact me.
All right.
Okay. I will supervise him, but I'm actually very, very rigid though. So things have to be done. No, so for me to actually say it, there is no edge with the way that I supervise. It has to be done properly.
All right, sir. So also too, sir, we need to also discuss the courses we are taking this semester with you, sir.
Okay, fine. Good. Possibly we should have to meet again. That is the morning of next week, Monday. Both of you on Zoom.
Monday, sir.
Yeah.
That's
which day? Both of you
What time,
discuss.
sir?
Yeah. And for me, 10 o'clock is always best. That's that Monday or Tuesday.
Okay, sir. Both of us will discuss. I will reach out to you on WhatsApp, sir.
Okay, good. Perfect.
All right, sir. Thanks, sir. Thank you, sir.
Okay,
And
thank you so much.
Your mail, sir.
Yes, I already sent it.
Okay.
Ogbeiwi at unimed.edu.ng.
All right, sir.
Okay.
Thank you.
Okay, now see you guys soon.
Thank you, sir.
Okay, God bless you all.
Amen.
Yeah, bye-bye.
Bye, sir.
Thank you, sir.
Thank you, sir.
Okay, God bless you. So please, 22nd June, 10 a.m. I am begging you. Thank you. God bless you all.
Amen.
Bye-bye.